Hi, my name is Dr. Mark McRae. I'm a board-certified plastic surgeon, and I have a practice that specializes in facial plastic surgery as well as breast plastic surgery. And so I'm going to speak with you today, in the next 5 minutes, if I can fit it into that time, about breast implants and the information that you should know before you get breast implants. Now, it's important to know that breast implants have been very well-studied devices for many, many years, and the overall safety is quite reasonable and quite good. However, you really do need to know this information before you go on to breast implants. This could be for breast augmentation purposes, such as after babies, or this could be for purposes of breast reconstruction. Either way, there are things you need to know. So let's get into it. The first the quote I'm going to have here is from this document. A lot of this you can find at the FDA website, and it's what to know about breast implants. Well, in this quote, the FDA, which is the Food and Drug Administration in the United States, says that FDA-approved implants undergo extensive testing before approval to demonstrate reasonable assurance of safety and effectiveness. Now, that being said, there is a black box warning that the Food and Drug Administration in the United States has placed on breast implants, and this must be known by the patients that are going to be receiving them. In Canada, there's no such rule per se. However, for my Canadian patients, I do think it's important for you to understand these. And the first warning on that label is that breast implants are not lifetime devices. That means that if you are coming to me for a breast augmentation or a breast reconstruction, there is a reasonable likelihood that you're actually signing up for 2 surgeries. So you're signing up for the surgery for me to place the implants, and at some point you will need another additional surgery, either for a revision or for removal of those implants. Now, a often quoted number is 10 to 15 years in terms of the amount of time that it might be required before an exchange of an implant. That being said, I don't think there's any hard and fast rule. I think that breast implants can last significantly longer than that for some people. But as we're going to talk in another video about some of the issues that can happen that require revision, it's a reasonable expectation that 10 to 15 years should be around where you may need another replacement. The second black box warning is that there is an association between breast implants and something called breast implant-associated lymphoma. So this is a cancer of the immune system, not of breast tissues themselves. This entity is quite concerning and really came to the forefront in the last 5 years or so and resulted in a recall of certain breast implant devices. This is most associated with textured breast implants. And texturing is something that happens on the surface of the implant and that allows the tissues to ingrow and keep the implant in a certain position. This was important for implants that were of certain shapes, such as gummy bear teardrop implants or anatomic implants. However, in my practice, we don't use those implants, and they are in circulation still with other practices. However, it is much less common now that this is known. So typically, breast implants now are smooth and round, and we do not see the same association with them. However, the FDA does not think that the risk is zero. There's also been known to be a couple cases of squamous cell cancer around breast implants. These are exceedingly rare, but the FDA is looking to collect any information of patients that may have had this association. The third warning in the FDA document is about capsular contracture. This is a reason why patients may require reoperation in the future. And what this is simply the body's response to anything foreign in the body, or any surgery for that matter, or any trauma. The body will place scar tissue. If that scar tissue is too robust or too thick, particularly in the breast, what that can create is, one, it can cause pain. It can cause malposition, so the implant actually changes in this position. It can be firm and hard, so contracture, and it could actually cause a visible issue. So that's the different grades of capsular contracture, and so that can also happen with breast implants. A little bit higher of a rate for people that are getting a reconstruction, particularly in women that have had radiation. A little bit much lower in those with breast augmentation. Now, speaking of that further, we can talk about ways to prevent and avoid capsular contracture now that we have a much better understanding of what this is. and we can talk about that in another video. It's a particularly important one, and I think I personally take many steps to avoid this, because there are some very preventable things that can be done to reduce that risk, not eliminate it. The fifth one is breast pain, and that kind of dovetailed into the capsular contracture conversation. But pain in general can happen whenever there's been any kind of surgery or any trauma in any way. There are some nerves that are either stretched or divided when there's a breast augmentation or breast reconstruction performed, and so that can result in pain. Finally, rupture of the implants, since they're not lifetime devices, and we will have a picture of breast implants for people to see. What you can see, but is notable about breast implants, is that there is a silicone exterior, and then it can be filled on the interior with either saline, which is salt water, or silicone gel, which is quite cohesive. So if you cut a breast implant in half now, the majority of the implants out there don't actually have gels that run. They kind of sit there, almost more like a gummy bear type. That being said, if it ruptures and it's a saline-filled implant, it'll deflate, and we'll know to replace it at that point. Whereas silicone implants, they may change shape or you may have some issues, but generally those are screened for. And so with silicone implants, we generally recommend imaging. In the United States, the imaging modalities recommended are ultrasound or MRI. And those can be started at around 6 years after the initial placement of the implants, just to assess the integrity of them, and then every 2 to 3 years thereafter. But again, your specific situation, you may want to speak to your plastic surgeon about that. Another condition that has been found to be associated with breast implants is something called breast implant illness. Now, this is a very poorly understood diagnosis at this point. We know that it is exceedingly rare. That being said, I personally know that it certainly does exist, and the FDA thinks so too. I know this because, based on my practice at a tertiary level center, where I practice with the University of Toronto and previously at McMaster University, these are the types of places where patients will look for help for something like this, where they may have been passed around through the other levels of care with other plastic surgeons previously. The conditions that they describe are things like muscle aches, confusion, brain fog, tiredness, chronic fatigue, dryness. Some people have described autoimmune diseases. I think that the autoimmune association is not a good one at this point, based on the evidence. However, the treatment for breast implant illness, if it is suspected, is what I tell my patients that come with this concern, is removal of the breast implant. And with removal of those breast implants, those symptoms should resolve very quickly. I often see it the next day or within 1 to 2 weeks, certainly. I will tell these patients, though, that are concerned for this condition, that even if we are both suspecting this condition, there's only about a 50-50 chance at best that removing the breast implants will lead to resolution of symptoms. And that is because the symptoms are not being caused by the breast implants. If they are caused by the breast implants and are breast implant illness, then removal of the implants will treat the condition. Finally, we're not going to go into more detail today, but just because we want to make this video as brief as possible. The last one is just to mention is that there is a risk of infection with anything placed in the body, and that is more often a very shortly around the time of surgery, where you can develop an infection, and that would require the breast implant to be removed as well. Things that you can do to prevent that as well, things like smoking cessation, very important to not smoke if you're ever having any kind of breast surgery or breast implants placed, and other things and modalities and techniques that we can use. So I hope you find this helpful. This is definitely not the part of the consultation that we enjoy. However, it is really the most important in terms of understanding breast implants. And if you're going to choose to have these devices, you have to understand these potential issues as well. So if you have any comments, please leave them, and I'm happy to put together more content that is as educational and helpful as possible. Thank you very much.